Hey guys, Leki here from ProPhysio Plus. Today we're going to be talking about knee pain and why it's important for lifelong health. Please like the video, subscribe to our channel and share with your friends. Rightio, let's dive in. How do I know my knee pain is serious? An accurate diagnosis is really critical and needs to be addressed in two distinct areas. Number one, pathology, and number two, structure. In terms of pathology, we just want to understand what is going on. If it's a serious problem or if it's a fracture, once we rule that out and understand the inflammatory response to the injury, which is a normal response, then we can move to other management protocols, which we'll speak about, like peace, love, active rehabilitation and physiotherapy, and a bit of help with your doctor if medications are needed. Then the structure is really important and requires specific testing and examination. And the way the injury can occur is a significant clue to how we can arrive to a diagnosis. It may be a gradual build-up of pain. It may be an impact injury, trauma. There may be non-contact situations there, just developed over time. And maybe you heard a sound, a pop. All these factors help us in getting you the best diagnosis so we can help you move forward. Okay, a common problem is inflammation. It's a response to injury. And I'd like to introduce this idea of peace, love. Now, this acronym is really important because the idea, the shift, is moving away from RICE and towards this idea that I'm going to introduce. So P stands for protection, and it's really important to protect the injury, the problem, to avoid it getting worse. E is elevation. Essentially, we want you to raise the part above the level of your heart to drain the swelling, improve with your recovery, or help with your recovery. A is actually avoiding anti-inflammatories. Now, this is a bit controversial. Essentially, we're trying to avoid early anti-inflammatories like Nurofen, Voltaren, and icing in the early phase of an injury. Okay, and we can talk about this down the track, but avoid anti-inflammatories. C is compression, so just squeezing a part above slightly the injured part or around it to help with swelling drainage. E is education, understanding the problem, getting appropriate advice for timely recovery. L is for load, and this is just managing, listening to your body, listening to your own intuition, because appropriate load can also affect your wound healing, and it can also quicken your healing time frame. So really important to manage your load. My favorite acronym, or the letter within this acronym, is O, optimism. Now, when you're sore, when you're in pain, sometimes you can be very fearful of avoiding certain movements. We want to help you in encouraging positive movement because it allows quicker outcomes and quicker recovery. V is for vascularization. Basically, it allows better wound healing. Movement allows more nutrients, more blood flow, helps with optimal recovery. And E is exercise. As physiotherapists, we're all about exercise, so that one's obvious. Peace and love.
Hey guys, this is Leki Aarvi. So this is a Quickfire Q&A, questions that we get asked in the clinic all the time. So I'm going to ask the questions. First question is, what can I do to relieve knee pain?
Very common question. I like to think about this in two phases. So if your injury is hours, days, or weeks long, think about peace and love. Refer to that video that I've just shot. Really helps with good, active, early management. If your injury is weeks, months, years long, I'd introduce this idea from an osteoarthritic management plan called the GLAD program, and this is an international standard. Essentially, they introduce a first line of treatment, which is really helpful for the osteoarthritic population. That means education, exercise, and identifying your lifestyle factors is always your first point of action with knee pain.
All right, so question number two, what can cause knee pain without injury?
Okay, knee pain can be caused a number of ways without direct trauma or injury. In most cases, damage to the knee occurs slowly and over time. It could be overload or degeneration. And this could be just as painful or as significant as a direct blow, okay, so a traumatic injury. So these common types of injuries without a clear mechanism could be arthritis, bursitis of the knee, tendon pain, and other things like softening of the cartilage under the kneecap, chondromalacia. Gout is one from left field, and a Baker's cyst.
So question number three, is walking good for knee pain?
It is a very important question because we would never discourage active movement, but we just got to understand what the injury is and the severity of it, what caused the actual pain. So in most cases, walking is very helpful. As we said, we don't discourage walking because it allows the body to move and get blood flow into the area. It helps get nutrients to the injury site, and it helps with optimal recovery. So for the most part, yes, we would encourage walking.
And the final question is, what is the best exercise for bad knees?
Now, there's no global blanket rule for the best exercise. In this whole video presentation, we've spoken about the specific problems and what caused your knee injury. But from what we see in the clinic is a lot of this is the load, how much you're putting through the body, and how strong you are. Is there enough tolerance for you to the things that you're looking to do? So in the clinic, our go-to exercises after a good thorough assessment is making sure we're good and strong around our pelvic girdle, big strong backside, big strong legs, and that will help reduce a lot of the pain that you have in the knee. If you haven't checked it out already, Aarvi's run us through our lock clams. Big shout out to Dr. Andrew Locke. Be sure to check it out. That's our go-to exercise for knee pain.
Hey guys, so this is a great exercise that we do for knee pain. Shout out to Andrew Locke for creating this version of the clam. It's called the lock clams. So we're going to get straight into it. So we'll get you to lie on any side you like. Perfect. So what we want to do, Leki already knows how to get into position, which is perfect, but we're going to start from the start. So always start both legs on top of one another, arm resting on the head, and then all you're going to do, you're going to take the top leg and pop it behind the heel and just relax it there. So you don't want to tuck it in, just relax it, and then we're going to turn the whole body over until the hips sort of in hip extension. Okay, so foot's touching the ground, the body's nearly like you're on your stomach, and from here what you're going to do is you're just gently going to lift this knee without moving anything else. So we'll lift up the knee, beautiful, and back up. Try and lift it a little bit higher, good. And we should not have any movement coming here. So you don't want to see any rocking back and forth. That's going to bring in the back, it's going to bring in other muscles. We're just trying to work this area right here, and straight away you'll feel a bit of a burn in here. So what are the rep ranges we normally do? We normally start with 2 sets of 15 to 25 reps and do that twice daily. So if you're at home having a bit of knee pain, check this exercise out and give it a go and give us some feedback. Cheers.
Okay guys, I'm going to give you a common test you can perform on yourself if you have a knee pain. Now just be mindful, little caveat, there's lots of reasons why you could have knee pain. This test is if you have a kneecap tracking problem, very common. So what you can do on yourself is resting your legs on something just so that it can turn off your hamstrings. You can actually push your kneecap side to side. And what we're wanting to see when you're nice and relaxed is how much the kneecap is moving, and you can compare that to the other side. So you can see I'm sort of pushing and gliding the kneecap one way to the other. Now, if you find that you're getting knee pain and it's very stiff, it's very hard to move your kneecap inward, a lot of reasons may be because of muscles that are not working so well upstairs in your thigh and in your backside. So to avoid the jamming pain of your kneecap, I'm going to show you something called McConnell taping, which you can apply yourself. Okay? In short, what you can do, and you don't have to get too fancy, you can start by taping outside and then pulling your kneecap inward. Okay, now because I feel sorry for Aarvi and his follicles on his legs, I'm going to put just some Fix-A-Mold, same stuff that Band-Aids are made out of, the white stuff. And again, you can apply this yourself. So all this does is reduces the sensitivity of skin. If the space, the part is a little bit hairy there, then it can just help the comfort of the athlete or your client. Okay, so I've covered the whole area there pretty nicely. Okay, now remember you can see the outline here of your kneecap. Using your bit of rigid tape, you start outward, and then it's going to hook onto the kneecap, and you pull inwards. And we do want to see these wrinkles. And what it will do is it will help pull the kneecap inwards. Now, if I go with a couple of stirrups of tape, it doesn't have to be mega taut, like I'm not pulling too forcefully. Okay? And depending on the bulk of the size, you know, the meaty part of the thigh, you can go a couple of times. And what that will do is it will push back against these muscles that are pulling your kneecap outward, which causes a lot of this non-specific kneecap pain. Okay? Now, once you've done that, you can cap it off. So it feels pretty solid. Nice and sturdy. Okay, there you go, nice and neat. So outward in, lock it in nicely. This is good enough for a rugby player to run around, doesn't come off too badly. Okay, enjoy. This is something you can do for yourself for kneecap pain. Okay, so there you have it. We've laid out how you can get on top of your knee pain. So let us know how you went with it. Please like the video, subscribe to our channel and share with your friends. It would really help. And we hope to see you again soon. As always, making healthy simple.